Dr. Money was famous for his concept of saying, I have an idea. Let's do this and see what happens to the patient. No science, no ethics, just an idea in his head. And this is what drove him to do what he recommended to the patients. Number one, he thought you could change genders with surgery and counseling. He first did this with infants. The tragic case of the amputated penis was a story of a little boy who was one of twin boys who was born as a male, recognized as a male. Were in the newborn nursery. The parents wished them to be circumcised, and so they were. The person doing the circumcision on this particular boy noticed a bleeding point that needed some attention during the circumcision, and he chose to use what's called a Bovie cauterizing device. It's an electric stimulating, it looks like a pencil with a cord attached to it to a machine that generates electricity and heat at the tip of the Bovie instrument. It has two settings. Cautery, which is just a little bit of electrical power, which essentially coagulates bleeding points, burns the tissue just slightly so that if there's a vessel that's actively pumping blood, little artery, it will actually burn that tissue and fuse it and make it stop bleeding. The second, and more commonly used, is the cutting strength, the second setting, which is extremely powerful and which essentially divides the tissue as if you're cutting it with a knife. It was set on the wrong setting, and he applied it to the burning point, and the boy's penis was burnt off completely. So this was a tragic event that the parents had to deal with. They heard about the Hopkins Center for Kids Who Needed Reconstructive Genital Surgery, and they brought the baby there. Dr. Money interviewed the family and advised them, with an idea in his head, that this child should be reared as a female. So the child was essentially, had the testicles removed, the base of the penis that was left was revised and buried in the tissue, and beneath the tissue where the scrotum once was, they created a vaginal opening, an artificial vaginal opening. So this child was anatomically changed into a female by surgical procedure. And the family was counseled very simply, this is what you do. You have a boy and a girl. They're a set of twins, and you raise the girl as a girl and the boy as a boy. Now, Dr. Money followed these patients moving forward with his group and fellows, and it is reported in his annals that he actually suggested that in order to adjust to the sexuality, the newly assigned sexuality, that these two children should play with each other's genitals. Again, today that would be thought of as a perverse concept, but it was an idea he had in his head that he thought would possibly help the girl assume the girl anatomy and identity more frequently. This child had to have regular dilation of the vaginal structure with little dilating devices called bougies, and it was painful, and the child had a great deal of psychological trauma which occurred because of this process. But it was the only way to keep that sort of vestigial, artificial vaginal area open, and so it wouldn't scar down and close completely. So that's the case of this young fellow who turned into a girl, or was turned into a girl. This child began to have severe problems with depression and anxiety as she grew up. And the therapist that was working with the family outside of Johns Hopkins finally suggested to the parents that it was time that they let this child know that he was actually born as a male and what had happened to him. And when that happened, he had an awakening and realized that that was probably the root of everything that had been bothering him internally as a traumatic event. And he asked to be changed back into a boy and live the life of a boy. So the surgeons closed up that vaginal pouch. They essentially took the stump of what was the left of the phallic tissue and unburied it and brought it out so that it could become a somewhat functional penis. That young man grew up as a young man, married, and subsequently took his life. At the point in time where that hit the newspapers in the United States, John Money's career began to abruptly diminish, and his level of respect began to diminish as well.